Assalamu alaikum. My name is Hania Khalid. I'm a fourth year BDA student in Karachi Medical and Dental College, also known as Karachi Metropolitan University. When I saw the competition poster, environmental awareness topic interested me greatly, as I see it in my own daily practice, how much plastic goes to waste, the time it takes to get any procedure done, and the energy and water consumption for that procedure. I chose this topic to make my fellow dentists understand and be aware of the action and the impact it has on our environment. Before we start, here is the list of issues that I will be discussing. Now, what does the word green dentistry mean? Green dentistry is defined as an approach to oral care that reduces the environmental impact of dental practices. To achieve the goal of green dentistry, we need to be aware of our actions on environment as each action has an invisible impact. FDI's vision of 2030 outlines a strategy to achieve their goal. Their goal is delivering optimal oral health for all and focus on environmental sustainability. I will first discuss the impact mercury has on environment. The mercury menace. Mercury is highly toxic and persistent. It can travel long distances through atmosphere and accumulate in food chains. Its toxicity can lead to tremors, headaches, insomnia, muscle weakness, and twitching. When dentists remove or place amalgam fillings, tiny pieces and dust can get washed into suction system. For all these reasons, a treaty named as Minamata Convention on Mercury was adopted. The goal was to protect human health and environment from emission and releases of mercury. It addressed that dental amalgam filling, which contains 50% mercury, be face down. It promotes dental team to set objectives for dental caries prevention to reduce the need for filling, use other effective mercury-free alternatives, restrict its use to encapsulated form, and use amalgam separators. Amalgam separator is a device that filters mercury-containing particles from dental offices' wastewater. The captured amalgam is collected in a container and sent for specialized recycling. In this way, the impact of mercury on environment can be controlled. Now let's discuss the plastic pandemic within dental office. In practice, dentists heavily rely on disposables using hundreds of pairs of gloves, masks, plastic sterilization pouches, and plastic cups in a single day, and then immediately disposing them. According to the article Healthcare's Climate Footprint, supply chains for these disposables accounts for 70% of healthcare's total emissions. Now let's talk about the solution. How can we move closer towards the goal of green dentistry? We need to reduce consumption of single-use plastics, switch to biodegradable pouches, rethink our reliance on these materials, and recycle the waste we dispose of every day. Moving on to a practice performed multiple times in a day. Dental X-ray. A publication by Complete Smiles compares a traditional X-ray and digital X-ray in great detail. It states that a traditional X-ray utilizes silver thiosulfate and lead foils as developers, which are hazardous to human health and environment. Takes 5 to 20 minutes, its image quality is fixed, and the physical file may get damaged if not cared for properly. A digital X-ray in comparison is eco-friendly, no chemical waste is produced, takes 3 to 5 seconds, its image quality can be adjusted by tuning brightness and contrast, and generates a digital encrypted file which is easily stored. Based on this article, digital X-ray is efficient, clearer, and easier, and since the chemical waste problem has been eliminated with its use, digital X-ray should be preferred in dental practice. Now let's look at how we can apply environmental awareness directly to our daily clinical operations using the 4 R's framework encouraged by FDA Vision of 2030. In a medical setting, we have to rethink to balance safety with sustainability. We should ask ourselves, do we truly need a single-use plastic barrier on a handle that can be effectively sanitized with a disinfectant wipe? By choosing disinfection over physical plastic barriers, we can significantly cut down on clinical waste. Next is reduce, and the easiest win here is going paperless. By transitioning to digital charting and emailing receipts rather than printing them, we eliminate a massive stream of paper waste from our administrative side. The third R is reuse. We can switch from disposable plastics to sterilizable alternatives for certain tools. For example, using stainless steel suction tubs and impression trays allows us to provide the same high standard of care without the one and done plastic waste. Finally, for the items we cannot eliminate, we must recycle. This involves partnering with specialized waste management services that are equipped to recycle specific dental items such as toothbrushes. We often talk about sustainability in terms of materials, but the most powerful tool for green dentistry is actually clinical prevention. The concept is simple. The most eco-friendly filling is the one that is never placed. Every time we successfully prevent a cavity, we eliminate the need for the materials, energy, and waste associated with a restorative procedure. To achieve this, we are shifting our focus towards minimally invasive dentistry and prevention strategies. By intervening early or preventing disease entirely, we move away from a drill and fill cycle and move towards a more sustainable health model. Ultimately, a healthy patient population is the most effective way to lower our practice's carbon footprint. To wrap up this discussion, it is important to remember that environmental awareness in the dental office doesn't require a total overnight transformation of your practice. Instead, it is the accumulation of small intentional changes in how we handle supply chain, waste management, and strategies that yield massive results for our planet. If there is one thought I want to leave you with, it is this: the most eco friendly dental treatment is the one that never needs to happen. I encourage each of you to look at your own practices through this green lens. Let's commit to prioritizing prevention, because at the end of the day, a healthy smile shouldn't cost the earth. Here are the references for my presentation. Thank you.